As Hong Kong confirmed its first death from the virus, a quarter of its doctors and nurses went on strike, seriously affecting emergency services. Several hundred demonstrated outside the offices of their employer, Hong Kong's health authority. They say the complete closure of Hong Kong's border with the mainland would help prevent the disease spreading. They're members of a new union born out of the protest movement. Politics have now entered this growing public health emergency.
I hope the government quickly listens to our demands, quickly closes all the borders and brings this epidemic under control.
By Tuesday, 10 of the 13 border crossing points with the mainland were closed. But the bridge to China remains open, now one of the few ways into or out of Hong Kong. When this bridge opened almost 3 years ago, it stood as a symbol of the deepening links between Hong Kong and China. Today, it stands as a symbol of the few border links that now remain between the two. Hong Kong's leader, Carrie Lam, is resisting calls for a total shutdown of the frontier, saying it would go against the guidelines of the World Health Organization, and rejects accusations that her administration is the one playing politics.
I certainly would not agree with the allegation that we are sort of not addressing this public health concern adequately. And certainly I don't agree with the allegation that we are putting politics above public health.
The economic fallout from this emergency has spread to the nearby gambling hub of Macau, popular with mainland tourists. All casinos will be closed for 2 weeks. In Wuhan, a new hospital built in just 9 days has begun treating patients. Another 3 mobile hospitals are being assembled. In a rare move, China's government has appealed to the outside world for help, saying vital medical equipment is needed, including more face masks and protective clothing for medical workers. Doctors also say there's a shortage of testing kits. In another unusual development, China's top leadership has admitted to shortcomings and failures in its response to the crisis. The Politburo Standing Committee, chaired by President Xi Jinping, warned that officials who failed in their duty would be punished. That amounts to a public acknowledgment that they failed the people. Adrian Brown, Al Jazeera, Hong Kong.
All right, let's go live to Scott Heidler now, who's in Beijing. And these are most definitely extraordinary times, not just in China, but in the region as a whole.
Absolutely, Martine. Yes, when you look at what's happened over the last 10 days or so, you've had a couple of highest level admissions of missteps, of challenges, of problems, things that need to be corrected from the top level of the central government here in China. You've had local governments admitting that they fumbled things at the very beginning. But what we've been seeing, particularly on state-run television here, a lot of images of this new hospital that has just opened up. There's another one that's going to open up tomorrow. A lot of images of supplies coming in. But again, there's this call from outside of China that they need these medical supplies, as we heard in Adrian Brown's piece right there. But one thing that's interesting, we have all those challenges, but also there are other challenges too. And the World Health Organization in just the last hour kind of went through, dissected some of these other challenges, and one of them is misinformation.
When you deal with epidemic, you rapidly see that in addition to the epidemic of diseases, we often have an epidemic of information. And this is what we call infodemic. And it's really an epidemic of rumors, of false information that is circulating at the same time. And every outbreak has its infodemic. And so we have realized over time that this infodemic could be really an obstacle for a good response and hamper effective implementation of countermeasures.
And so there we saw the WHO warning about an overload of information, if you like, an avalanche of information. So what's happening to those people in China who are pretty much restricted to their homes, being able to nominate, in some cases, one person to go out for provisions every other day? I mean, what are they doing?
Yeah, there's one thing that also in that WHO press conference I've mentioned that one mechanism that the Chinese government has put into place is to circle these areas where the epidemic has kind of been centered, and that is Hubei province. And she had mentioned that, there are clusters that have sprouted up in other places still very close to Hubei province, and that's what they're trying to do, encircle those clusters to prevent further spread. And the way they're doing that is they're locking it down. Probably something you can really only do in a country like China. So what they're doing is in some cities, now not in Hubei province, what they're doing, as you mentioned, Martine, that they're restricting people from going out on the streets, nominating one family member who will go and get the supplies for their household. In other cities, there's, no one allowed on the streets. In some cities, if you don't have a face mask on, you'll be sent back home. So there are a lot of different kind of stages of that kind of control, if you will. But again, it's one thing to look at that this is what they're trying to do. They're trying to encircle where these clusters are, preventing it from spreading further. But, when you look at the gestation period, the incubation period, I should say, about 2 weeks, the big concern is that, you could see clusters sprout up elsewhere because of the person-to-person transfer of this virus. So obviously looking at it very, very closely. But again, some of these control mechanisms in place that China's put really probably could only be handled by a government like we have here.
Scott Heidler live in Beijing. Thank you.